Welcome to Medicine Handy Point. Today we are discussing the role of pro-BNP in diagnosis of heart failure. So this is very important topic. Let's start it. Now, the thing is that pro or nt-probnp is actually the short name for N-terminal pro-B-type natriureteric peptide. What is this thing? This is actually a peptide which is released by the ventricular wall in response to volume or stress. So it is actually released by the ventricular wall in response to the volume and stress. Now, this makes it very important in diagnosis of heart failure. So we can use nt-probnp in the diagnosis of heart failure. So if we combine this enzyme level in addition to the clinical examination and the echo finding, we can establish the diagnosis of the heart failure. But as always, there are few condition in other than the heart failure in which this pro-BNP peptide will be raised. So what are these conditions? These are advanced age, kidney dysfunction like kidney failure, pulmonary hypertension, atrial fibrillation, sepsis, and anemia. So these are the condition in which actually this enzyme will be this peptide will be raised. So pro-BNP should be interpreted very cautiously if the above condition are present. So ideally it has its value when these conditions are not present, and echo suggests heart failure and clinical examination support it as well. So in that condition, pro-BNP is very helpful in confirming and reaching the proper diagnosis of heart failure. Thank